Welcome to Healthy, Wealthy, and Wise. We're so glad you've joined us today. I think we can all agree that our greatest wealth is our health, or potentially so. And if we together can address some of these things that will help us prevent disease and promote our health, we truly can be healthy, wealthy, and wise. We're so delighted to have joining us today Dr. Carl Bauer, a gastroenterologist, internist, as well as a nutritionist who has a master's degree in nutrition from University of California, Davis. Carl and I go way back together. We actually have to admit to graduating from the College of Medical Evangelists, the last class, as a matter of fact, which is about 46 years ago, I think. Spent some time in Japan together also. And Carl has a tremendous amount of background and treatment experience with people with gastrointestinal problems. And so we're so happy that you've joined us today, Carl, and want to start out our program today by asking about one of the most common problems that people are faced with when it comes to their GI tract, and that is heartburn. Tell us a little bit about why that happens and what can we do to prevent it?
Heartburn is a symptom of gastroesophageal reflux disease generally. And to understand what that is, we need to look at the esophagus a little bit. The esophagus is an organ that serves as a conduit between the mouth and the stomach.
Some of us would call it the food pipe, maybe.
Right. And it has a sphincter at both ends. The upper esophageal sphincter is a very powerful sphincter that keeps us from aspirating food into our lungs. And that sphincter has a resting pressure of 80 millimeters of mercury, the most powerful sphincter in our bodies.
That's a muscle then that controls and tightens down.
Right. The lower end of the esophagus has another sphincter that we call the lower esophageal sphincter, and it has a resting pressure of only about 12 to 15 millimeters of mercury, so it's a much weaker sphincter. But this is necessary to prevent acid from the stomach from refluxing into the esophagus. The esophagus is lined with cells like our skin. We call it squamous epithelium. And it is very sensitive to acid. If you spill a drop of battery acid on your skin, you get a bad burn right away.
Yeah.
And the acid in the stomach is just like battery acid. It's hydrochloric acid, but it has a pH of 1, just like battery acid. So it's very strong acid. And if it is refluxed into the esophagus, it damages this squamous epithelium and will often cause ulcerations and inflammation there.
Sounds pretty painful.
And that causes heartburn. But it's of interest that only 2/3 of patients who have reflux esophagitis have symptoms. The other third don't have any symptoms at all.
So 1 out of 3 could be having this damage there and wouldn't even know it.
Wouldn't even know it. And so it's a serious disease, and it affects a very large number of people. Estimates are that almost 20% of the American population suffer at times with reflux symptoms. So it's a serious problem, and we should try to control it if we can. There are a number of things that predispose to reflux disease. One of them is tobacco smoking. Nicotine is a potent relaxer of the lower esophageal sphincter. And in fact, you can measure the pressure drop in the sphincter dramatically while one smokes a cigarette. So that's one of the causes. A second cause is having a hiatus hernia. A hiatus hernia means that an upper part of the stomach is herniated through the diaphragm up into the chest. And that displaces the lower esophageal sphincter up into the chest, where it functions less efficiently. It's of interest that our chest cavity, where the lungs are located, has a negative pressure. That is, we breathe by sucking air into the chest. And that negative pressure is about 5 millimeters of mercury minus. Whereas the stomach in the abdominal cavity has a net positive pressure of about 5 or 6 millimeters of mercury. And so if it weren't for this sphincter valve, we would always be refluxing into the esophagus. And so that sphincter has a very strong reason for being, and when it doesn't work properly, then we get acid regurgitation.
Sounds like big time trouble.
Big time trouble.
Would smoking change the acid part of the stomach? Is there more acid production or nothing to do with that?
Doesn't seem to affect acid production in the stomach. It's another thing that has been shown to cause reflux or to promote reflux is to have an increased amount of abdominal fat, because obviously that increases the pressure in the abdominal cavity, and the higher the pressure in the abdominal cavity, the more likely it is to overcome that pressure in that valve, so that reflux is more likely to occur. So obesity, smoking, hiatus hernia, and then the final factor that is known to be a predisposing one is heredity. People who have reflux esophagitis are more likely to have family members with the same disease.
So we can't change our genes, nothing much we can do about that. We better work on the others.
Right. The other three we can do something about. The lining cells of the esophagus with chronic acid injury change from this squamous epithelium, like our skin, to a columnar type cell that is actually pre-malignant. And we call that change, when it occurs, Barrett's esophagus, after the doctor that first described it. And that leads to esophageal cancer. The specific word for it is adenocarcinoma of the esophagus. And that cancer is one of the most rapidly growing cancers in the American population.
Oh my.
It's becoming more common, in fact, than stomach cancer.
Now, is that partly because of the cigarette smoking problem over the years?
Right. That's a contributing factor. But reflux disease is the primary cause.
But maybe the obesity thing is a bigger factor even now, because we see this epidemic of becoming overweight in the United States population.
Right. Yeah, all of those are contributing factors. And so if you have a chronic injury situation where the cells of the lower part of the esophagus are being chronically irritated and injured over a period of time, it's easy to surmise how that could change the epithelium into a cancer type of epithelium. Much the same as occurs in the colon when chronic ulcerative colitis over a period of years changes the epithelium of the colon into a malignancy. And so the same kind of thing is happening in the esophagus.
Well, it sounds like something we really need to pay attention to. So if a person is getting some heartburn, it's not the kind of thing you just want to wait around and see if it's going to go away for too long.
That's right. You don't have to watch too many ads on TV to realize how common this problem is. When you see the ads for Nexium and Tagamet and Pepcid and all of the antacid ads, and so a lot of people do suffer from this problem.
You can get these medicines over the counter, many of them now, can't you? Almost all of them.
That's correct. Inasmuch as one can have this disease without having symptoms, a third of the patients don't have symptoms, it is a serious problem because the problem can sneak up on you without your being aware of it.
So 1 out of 3 people has the problem and doesn't even know about it.
That's right.
So what do you do? How do you avoid the consequences?
Well, there are other symptoms that can occur as well as heartburn. Heartburn is the primary symptom, but you can have other symptoms of reflux as well. One of them is hoarseness. One of them is a chronic cough, vocal cord injury. All of these things can be caused by chronic acid reflux.
So it doesn't take a lot of this really powerful acid from the stomach getting up into an area it's not supposed to be, where the pH is supposed to be so much different, to start this sequence of things, including the hoarseness and the coughing. And I've run into patients that I've been startled by because they have, at night, it's a nighttime cough basically, isn't it?
Yes.
So they'll wake up in the morning, they'll have cough overnight that wakens them, and then in the morning they may have some hoarseness or a cough persisting. That's really a big red flag, isn't it?
And the reason it's worse at night is that when one is lying supine, the barrier the blessing of gravity is not present. Gravity tends to keep the acid down in the stomach where it should be, but when you lie flat, you don't have the gravity benefit, and therefore acid reflux is more common at night, and that's why doctors will often tell their patients to elevate the head of their bed to help prevent the nighttime reflux.
Well, I've had some patients that use pillows. They'll pile up
Yes.
3 or 4 pillows. Does that help at all?
Right. That can be done too.
Could it be a problem because you're causing some squeezing on the stomach?
Well, it isn't as effective as elevating the head of the bed because as you move around during the night, you tend to level yourself, and the pillows don't keep you up as well as does slanting the bed. Or you can buy a wedge to put on your mattress that will do the same thing.
I see. So elevating the head of the bed, is that a big problem? Is that a hard thing to do?
No, it's very easy to do, actually. Just put a 4-inch block under the head boards of your bed, and that'll elevate the whole system so that you'll be draining downhill.
So 4 inches is enough to do the job?
Mm-hmm.
Well, that's great. So what other things could be associated with this reflux esophagitis then? Is there anything else food-wise that can make it worse?
Foods, obviously, that stimulate a lot of acid secretion are more likely to cause reflux than foods that don't. For instance, fatty foods don't stimulate much acid, but protein foods do stimulate a lot of acid. So a high protein diet would be a diet that would tend to promote reflux, whereas a low protein diet would not.
And describe for me a little bit what a low protein diet would amount to compared to the usual American diet.
Well, the usual American diet has 80 to 120 grams of protein a day. The recommended dietary allowance for protein is 50 to 60. And so most Americans eat twice as much protein as their bodies need. And that can lead to a number of problems, not just this problem, but a number of them.
Is that partly because the fast foods are so high in protein, most of them?
It's because of the large amount of animal products that are eaten in the American diet. All animal products have very high levels of protein.
Well, as an aside, I think of patients who often come in and say, well, I'm not getting enough protein if I'm going to go on a high vegetable, fruit, legume even maybe, and people thinking in general say, well, if I'm not getting enough meat, I'm not getting enough protein.
Well, that's really an idea that is fundamentally false. There are many, many, many studies now around the world that show that a diet that has no animal products at all provides more than enough good protein.
Well, that's encouraging to hear. I think both of us have been pretty much vegetarians, or at least lacto-ovo vegetarians, most of our lives. So it's not something that many people would be, the usual diet wouldn't be that kind of diet, the lacto-ovo vegetarian, because they'd feel like they've got to get some protein from an animal source in order to be healthy.
Yeah, that's true. But I think that the overabundance of protein in the American diet is one of the causes for the problems that the American population faces. And we could talk about that another day. It's a big topic, and there are many aspects of it, but I think just to summarize, it's good to keep your protein intake at or near the recommended dietary allowance.
Now, I just remember flashing into my head that when we were together in physiology in medical school, that they were telling us that caffeine was a pretty powerful stimulant of stomach acid. Is that true?
That's true.
That's still true, all these years later.
Actually, caffeine has been blamed as the stimulant, but actually it's something else in coffee that causes the acid stimulation, not caffeine.
So you're telling me that if I were drinking decaf, I'd be in just as bad shape
That's right.
as drinking regular
That's
coffee?
right. 1 cup of coffee increases the acid in your stomach 6 times normal for 6 hours.
Wow.
So, and studies done at the University of California, San Diego, and other places have shown that you get just as much acid stimulation from decaf as you do from regular coffee.
Oh my. Well, I've got to be careful about how much decaf I drink. I have patients that will tell me they drink a pot of coffee. Maybe they have it at work, I guess, or something, or they eat 1 or 2 pots of coffee a day. I don't know how many cups that is. Must be 10, 12 at least.
Yeah.
Wow, that's amazing.
And that's certainly a contributing cause for this whole reflux problem.
So then we wouldn't translate that to things like, say, drinking Coke or Dr. Pepper. That wouldn't be related to this kind of problem, to excess acid in the stomach.
Correct.
Okay. What could we do then from a practical standpoint to cut down acid? We're thinking of 1 out of 3 people that has this problem doesn't even recognize it. People don't recognize this. So what would you do otherwise than in the general prevention kind of approach to keep that acid problem down, even if they had, say, a genetic predisposition to a little acid reflux? What else could be done?
Well, I think the key importance of keeping one's weight near normal is an important aspect of it. Avoiding coffee, avoiding tobacco, and if you do have a family history of esophageal cancer or a severe heartburn problem in your family, then you need to be under much more careful surveillance for this problem to prevent the end result of esophageal cancer.
So what would that surveillance amount to? What would be a good recommendation?
If you are a person who has chronic heartburn that has been a troublesome symptom for a long time, or if you have a family history of esophageal cancer, then you should be under the care of a gastroenterologist and have periodic upper endoscopy to examine the epithelium of your lower esophagus. If you do that, that can be sampled and looked at under the microscope, and a pathologist can tell you whether or not you have the change in the esophageal lining that will lead to cancer.
How often would that need to be done?
That would need to be done at least 2 years. Some people say every year, but at least every other year. And there are now a number of treatment programs that are being developed to try to reverse the damage to the lower esophagus. And of course, among those are acid inhibiting drugs to shut off the acid so that you don't have as much acid when you reflux. And that's a whole nother subject, but we ought to say a few words about that.
Yes, let's address that. There must be some side effects from some of these medicines too.
Yes. The proton pump inhibitor group of drugs like Prilosec and Nexium, there are 5 or so of those drugs now available, are now available over the counter. And so there are large numbers of people using these drugs without a prescription because they can be purchased over the counter. And these drugs are extremely powerful inhibitors of acid secretion. They literally shut off the proton pump in the parietal cell of the stomach where acid is made and stop acid production. And when you don't have acid in your stomach, obviously then when it refluxes into the esophagus, it's not going to cause injury. And so that is helpful both to treat the symptoms of reflux disease and also to prevent the epithelial damage over a period of time that leads to cancer. But the other side of that coin, the problems associated with the chronic use of proton pump inhibitors, needs to be addressed also. Acid is of importance in digestion. It's the body's primary defense against enteric infections because acid in the stomach normally kills the bugs that we ingest with our food and keeps them from causing infection in the GI tract.
So when they go on down then into the small bowel, you don't have the problem if you have the acid there, you don't have the problem of infection.
That's right. And there are a number of infections now that have been shown to be much more common in people who use proton pump inhibitor drugs than in the normal population. And one of those diseases is Clostridium difficile infection, which is a bug that normally grows in the colon but is kept under control by the normal flora of the bowel. But when we take antibiotics, strong antibiotics, it will kill off that normal flora, and these bugs overgrow, and they produce a very, very powerful toxin that causes tremendous damage to the lining of the colon. And Clostridium difficile infection produces a disease we call pseudomembranous colitis, which is now an epidemic in many hospitals in the United States.
Partly because of all the antibiotics being used, killing off the good bugs. So these are good bugs there that we'd like to have, but they're being killed off by all the antibiotics.
That's exactly right. And proton pump inhibitor drugs promote the development of that problem. And a number of studies have shown that. Another problem that occurs when you use the acid-inhibiting drugs is that the absorption in the small intestine, the duodenum especially, where calcium is absorbed and where iron is absorbed, those substances require an acid medium for optimal absorption. And so if you don't have acid, you don't absorb calcium and you don't absorb iron very well. And therefore iron deficiency and calcium deficiency can result. And there are now a number of studies that show that people who use proton pump inhibitor drugs chronically have problems with not enough calcium and not enough iron.
Well, I appreciate knowing about that because I have a lot of patients on those, and I should tell them to take them as infrequently as possible to take care of the symptoms.
I think that they have to take them wisely and under the direction of a physician and not do it without some surveillance.
So we've talked about some good bugs that need to be kept there by having enough acid around to take care of the balance, make sure it's all balanced out. How about bad bugs?
Before I say that, Ed, could I say one more word about esophageal cancer?
Sure.
Esophageal cancer is a very real killer because there is no good treatment for it. Radiation therapy doesn't help. Chemotherapy doesn't help. And over 50% of the patients at the time of diagnosis already have metastases. And so it's essentially an untreatable type of cancer. So it's a very lethal kind of cancer. So it's one you want to prevent rather than deal with after.
So how do we do that?
Well, that's the whole idea that we're talking about here. Keep your weight normal, avoid tobacco, avoid coffee, and if you have a hiatus hernia, it might be worth having it repaired so that your reflux will be less likely to occur.
Good. Well, thank you for those good pointers. When we were in medical school, I can remember talking about, when you had heartburn, maybe it was a peptic ulcer disease or some kind of problem in the upper GI tract area there, and we were treating it with Maalox and antacids and various kinds of things like that. Even with the old sippy diet, we ate a lot of cream. Yeah. And we found out that wasn't such a good idea. Well, tell us about this gastric ulcer problem.
Okay.
Peptic ulcer.
We want to say a few words about good bugs and bad bugs of the gastrointestinal tract. One of the bad bugs is a bug called Helicobacter pylori, which was discovered by an Australian physician a number of years ago by the name of Barry Marshall. Dr. Marshall received the Nobel Prize in Medicine last year for his work on this bug.
I remember initially everybody thought that's poppycock. How could that be?
Right. We were all taught that stomach ulcers and duodenal ulcers were caused by too much acid. We now know that they are caused rather by this bacteria, which loves to live in an acid environment, lives most healthily when it's in an acid environment, and it is what produces the chronic inflammation in the stomach and the ulcers and eventually gastric cancer. And so peptic ulcer disease has undergone a total revolution in the last decade because of this discovery, and it is now appropriate to treat a peptic ulcer with an antibiotic to get rid of this bug.
Amazing. Rather
than antacids, which we were taught when we were in medical school.
Oh my. Well, I'm sorry we don't have much time left to go into it in detail, but tell us how you can prevent it.
Well, unfortunately, this is a bug that is very widespread in the world. And some populations have much higher levels of it and much higher incidence than others. The Asian population, for instance, has a rate of infection with this bacteria that may be as much as 2/3 of the population. And therefore, gastric cancer is very, very common, as you remember from our days in Japan, in the Asian countries, much higher than in the United States. But the good news is that this bug is being eliminated gradually worldwide because of the availability of potent antibiotics that are able to get rid of it. And so the good news is that peptic ulcer disease can be treated, can be eliminated, and once this bug is out of the picture, one needn't worry about that.
Well, that's good news.
The importance of hand washing and good clean hygiene with eating, though, is very important, because this bug is passed around in a family by contact, by intimate contact. Now, other harmful bacteria that may be worth mentioning, we've talked a little bit already about this Clostridium difficile bug, and recently an epidemic of this infection has occurred in the United States because of a more toxic strain of this bacteria that has developed in the U.S., probably because of the widespread use of antibiotics. And this bug spreads from one hospital patient to another very quickly and very easily.
I'm sorry, we're almost out of time. What can we do to prevent that?
Well, the prevention of it is, if you're healthy and not taking potent antibiotics, you don't need to worry about it, because healthy people don't get it. And if you do have it and have symptoms, you need to see a gastroenterologist early and have it treated appropriately with antibiotics that can cure it.
Okay, well, we'll pay attention to that. We want you to take to heart the things we've been talking about today, the prevention things especially, and we know that if you do, you can be healthy, wealthy, and wise, remembering that a merry heart doeth good like a medicine, Proverbs 17:22. Thank you for watching. See us again on LLBN TV, and thank you, Dr. Bauer, for joining us today.